Hello everyone. Today we are going to cover the topic of diverticulitis. The information is going to be presented to you by myself, Sarah Ewalt, Donna Lipscomb, and Brenda Salgado. Diverticulitis is basically translated to inflammation of the diverticula. Diverticuli are basically small sac-like projections that are attached to the colon. They tend to form in the weaker portions of the intestine, generally where the blood vessels penetrate the colonic wall. It is thought that the diverticula tend to form as a cause of intestinal pressure buildup. As to the specific cause as to why diverticuli tend to rupture is basically still under evaluation. However, the current causative theory is that diverticuli undergo traumatic damage as a result of small and large pieces of fecal matter that tend to get trapped within each of the diverticuli. As a result of this, this leads to inflammation and bacterial infection, or both. As a result of this, then toxic gaseous buildup occurs within the colon, which eventually causes a rupture of the mucosal lining into the abdominal cavity. Medically, there is a differentiation between the right and left diverticuli. Left-sided diverticuli are considered pseudo or false diverticuli, as they do not completely tend to herniate. Whereas right-sided diverticuli have more of a tendency to herniate and rupture, causing leakage into the peritoneal cavity. Right-sided diverticuli tend to be more common in the Western cultures. They believe this has something to do with the less healthy diets that we tend to ingest. Left-sided diverticuli tend to be more prevalent in the Asian population, again, and they think that is attributed to the fact that they have a healthier diet. In the event that people present with these symptoms, that can be confirmed via a colonoscopy. The type of individual that is subject to the risk of a diverticuli or diverticulitis are those who have a genetic or familial history of the disease, as well as people that are overweight, people that tend to have a diet that is high in fat and cholesterol, and less so in a high fiber intake. And also those individuals that have a decreased colonic motility, such as tends to occur in the older populations. For the majority of the population, about 80% will remain asymptomatic throughout their lifetime. About 20% will present with symptoms, and those symptoms are basically defined as lower left quadrant pain lasting for a period of 24 hours or more. Individuals will also present with bloating, flatulence, changes in bowel habits. Upon a nursing assessment, we'll be able to palpate an abdominal mass. There will also be nausea, vomiting, rectal bleeding, as well as signs of infection, which are indicated by fevers and high white blood cell counts.
Hi everyone, I will be talking about some clinical manifestations and diagnostic testing for diverticulitis. It is important to note a high percentage of patients may present with no symptoms. Asymptomatic patients usually find out they have diverticulitis during a routine procedure such as a colonoscopy or sigmoidoscopy. It is common for symptoms of diverticulitis to be mistaken for other conditions such as acute appendicitis, irritable bowel syndrome, and pancreatitis. With me today, I have a special guest who insisted on helping me with today's presentation. Patients with symptoms will typically present with acute abdominal pain, particularly in the lower left quadrant, which is the location of the sigmoid colon. They will also complain of bloating and report changes in bowel habits. A physical exam may reveal a palpable abdominal mass abdominal distension, and hypo or hyperactive bowel sounds. A patient may also have nausea, vomiting, and a fever may be present in cases of infections with labs showing an increase in white blood cell and leukocyte counts or an increase in C-reactive protein. Other diagnostic testing that may be performed include a CT scan with oral contrast, and abdominal and chest x-ray to rule out other causes related to the acute abdominal pain.
Hello and welcome to Carrington Hospital. Due to COVID, we have already spoken to our patient and told them all of the information that they will need to be educated about diverticulitis. At this time, I am now going to send out a video recording to all of my colleagues so we can all be on the same page with the consults that we will need to do for our current patient. Our current patient, unfortunately, has not been able to follow the guidelines of a high fiber diet and including more fruits and vegetables and fluid into his diet. So at this time, we are now going to refer him to a dietitian who can help him in the current situation and increase his chances of not having to have surgery. We also have included the surgical team in case we need to increase the chances of surgery. Currently, the patient will be hospitalized and he will stay in the hospital and have rest of his digestive system. At this time, we are going to ask him to remain in PO, and we also are going to include fluids through an IV. We also will be asking the surgical team to come and speak with the patient of the options that may be available through surgery. Unfortunately, through this time, we will have to include that because the patient is looking like they will need surgery. Surgery is a last resort for a patient, and when we do that, we go in and take out part of the damaged area, and we have them have a colostomy in place during the time that we have their abdominal rest. We hope that this won't happen for our patient, but if it does, then we will take care of that. We also will be looking into other options, which could include hospitalizing the patient even longer, but we would like to prevent that. At this time, we will be including not only the nutritionalist, the dietitian, but also the surgical team and a GI consult. With our GI consult, that may be our surgeon who performs the surgery. At this time, let me just follow up with who we will be bringing onto our team. Our team will now consist of our patient, moreover, and then also our team will consist of our current staff in the hospital for surgery, and we will also include our surgeons, our GI team, and our hospitalist. Thank you.
So the prognosis for diverticulitis can vary greatly because of the various clinical manifestations and level of severity. Being that diverticulitis only develops in patients who already have diverticulosis, anywhere from 10 to 25% of patients with diverticulosis will develop diverticulitis. And about 15 to 25% of patients with diverticulitis will require surgery with a 6% to 17% mortality rate for those who developed complicated diverticulitis. After successful treatment of a primary episode, only about 15 to 17% will have a recurrence, and the other 85% will not. Because there are so many varying levels of symptoms and severity, the prognosis of diverticulitis will be very specific to the individual, but overall, the risk of death from diverticulitis is low, and the disease can be managed effectively for many years, especially when caught before serious complications develop. Now it's a time for a quick quiz. The first question: which part of the colon is a patient who has diverticulitis most likely to have diverticula? A, the transverse colon, B, the sigmoid colon, C, the rectum, or D, the ascending colon? And the answer to that was B, the sigmoid colon. Question 2. What diagnostic test is performed to assess for diverticulitis? A, a colonoscopy, B, a Fleet's enema, C, a CT scan, or D, an X-ray? I hope everyone got that right, and it is a colonoscopy. Final question. When educating a patient about how to prevent diverticulitis, which teaching is best? A, this is a progressive illness that cannot be prevented. B, diet change and exercise can help. C, eat high fat and high calorie foods only. Or D, surgery is the only option for diverticulitis. And the answer to that one was B, diet change and exercise can help prevent diverticulitis. All right, that is the end. And if anyone has any questions, feel free to enter them into the chat.